Okay.
Great. Thank you very much, Christine. Good evening, everybody. My name is Tom Rogers. I'm the superintendent of the Syosset Central School District. Thank you for taking the time to spend the next hour with us this evening. I want to introduce some of the people who are on the call here with me. I have the assistant superintendent for curriculum and instruction, Dr. Teresa Curry, our school nurse and our head nurse and our school COVID coordinator, Ms. Joan Gonzalez, and our school physician, Dr. Ronald Marino, who works for Mount Sinai South Nassau Hospital. And thank you so much, everyone, for giving us a little bit of your time. Want to go through a number of data points with you and answer a flurry of the questions that we've been getting over the course of the last couple of weeks. And we thought that the best way to answer those questions would be to do it in a way that everyone had access to those answers rather than just the people who are asking the questions. And that's some of the context for the conversation tonight. But some of the context for the conversation tonight is to talk about how things are changing. So when I was 8 years old, and I told this story to the Board of Education on Monday night, we lived in Syracuse. And one night after work, my dad came into the house and said, everybody needs to gather around the kitchen table. We're going to have a family conversation. Now, as an 8-year-old, family conversation hadn't been something that had ever occurred before, and I didn't exactly know what it means. But I learned very quickly that family conversation means that Dad's going to tell us that we're moving to Binghamton, and I need to start saying goodbye to my friends. So I never had a great connotation associated with family conversation, but I think the point is every once in a while, we just have to have a frank conversation about what's going on so that we can make plans to do what needs to be done next. So I don't think that our conversation tonight is going to be as traumatic as moving to Binghamton. So I hope that's a collective sigh of relief for everyone. But as we've been going through this year, the one thing that I have observed is that every week feels like its own new challenge. We are on day 46, 47, 40, 49. We just finished day 49 of the school year. And obviously, we're watching that closely. But with every month and with every week, it does seem like things are shifting and changing a little bit. And we're doing our best to stay on top of that and want to share with you some of the things that we're observing. Because I think as a whole community, it lets us do better work together. So I'm going to share some slides and some information. We're each going to take a turn talking about some of the things that are going on. And then we'll have some questions and answers from Dr. Marino. And at the end, we do have a little bit of a surprise for you. So I'm going to spend a second and share my screen. And I'm hoping that's visible. So if maybe Joan or Teresa could just give me a thumbs up. All right, wonderful. So let's start the slideshow. So we've had a lot of success in these first several weeks of the school year. And I think the way I would frame it best is that we worked on building some really robust plans, and those plans have stood up well so far to the challenges that we've faced. But I worry that there may be a sense of complacency because of that. And so I wanted to share some other data points that are a little bit more sobering. So all of the superintendents in the state, when they close a school, have to report that. We've been following school closures in Nassau County for other school districts. And I think it's important to know that since October 8th, there have been over 120 school closures in Nassau County. So that signals to me that the virus is circulating. It has been circulating more in other communities than in our community up until now, although things do appear to be changing. We've only had to close once while we were working through our first contact tracing process. We've gotten a lot better at contact tracing internally, and we've gotten a lot faster in how we work with the Department of Health. And that's allowed us to move more quickly and make sure that we're on top of a situation, usually same day. And that's been what's allowed us to maintain our progress and our momentum. We've had 17 cases that are more than 14 days old in Syosset, and in none of those cases have we seen any evidence of further transmission through the school environment. Again, we still have a number of active cases, and I don't presume that this means it will always be this way, but we do feel like this is evidence that our early planning has been up to the task. Since September 8th, more than 150 individuals in our learning community have been placed into quarantine, some for exposure, but not transmission in the school environment, just exposure, and most for exposure outside of the school environment, whether that's sports teams or family exposure or gatherings or parties or kids coming home from college. There have been a number of reasons. Obviously, we need to know who's being quarantined because they can't come back to school until their quarantine is complete. And we don't report on quarantines, but it's important to know that there have been a lot of people in this community who have been impacted in one way or another. And so, again, I don't want to alarm anyone, but I also don't want to have a false sense of complacency either. My current fear and worry is that our ability to work quickly with the Department of Health is starting to slow. And it's understandable. When we opened at the beginning of the school year, the Department of Health was experiencing on average about 75 cases a day. Now they're in the neighborhood of 300 and 400 cases a day. And the resources that they have to be able to pursue all of this contact tracing are being spread far thinner than they had been previously. And understandably, it means that our cycle time of being able to report and get feedback from them is getting lengthier and lengthier. I also want to share with you what's going on in terms of New York State. So the state announced something that it's calling its microcluster strategy. And over the course of the last month or so, what the state has done is it's identified local areas that have high rates of virus transmission. They've been calling them hotspots. And what they've done is targeted the kinds of interventions that are going on in those hotspots. From that early targeted intervention, they've created this strategy, and they've come up with more formalized metrics of what drives their decision making around how they're going to define a hotspot, and then what they're going to change in a hotspot and make people do differently. So this is complicated. I'll try and simplify it with a couple of charts in a second. But one question that they're asking is, of all the people who take tests, how many turn out to be positive? That's the local test positivity rate. And over the summer, that test positivity rate was less than 1%. But recently, it's been triple that. Other metrics, are there on average 10 cases, new cases per day per 100,000 residents? So Syosset and Woodbury together have about 28,000 residents. So that would be, say, 1/4 of that would be, 2.5, 3 per day, just for comparison's sake. They also look at zip codes and whether you have 5 or more new cases per day in a zip code of more than 10,000 residents, which would be the Syosset zip code, or a zip code of less than 10,000 residents, like the Woodbury zip code, whether you have more than 3 cases per day. We're close to both of those metrics. And I realize our district encompasses a couple of other zip codes, Mutton Town, Oyster Bay Cove. Those are split across a couple of school districts, and that data we're not able to track in a way that is isolated just to the Syosset school district. So what does this look like? This is the daily positivity rate for all of Nassau County. What's not available to us, what we've requested, is positivity rate just for our community. But right now, at least, the data doesn't exist in that format. But we are able to get a hold of the data for the county as a whole. And the dotted line, the blue line, is the daily rate. But what the state measures is an average over the course of 7 days. So what the average does is it smooths out all of these ups and downs. So there might be one bad day followed by one really good day, and really on average, they're right in the middle. But what you see at the right end of the chart is that in the last week or so, we have crossed over the threshold that the state is using for its microcluster strategy to designate a yellow zone. That's countywide. So obviously this is not evenly distributed throughout the county. And again, we're unsure how much of this should be attributed to Syosset and how much should be attributed to other communities. But it is important to note that the county as a whole has now gone well above the 2.5% positivity rate metric. And, you know, I look at this chart and I see the summer months, July and August, where we were down around 1%. And then note that when September comes, things have picked up a little bit. So clearly it's possible to have a low rate of transmission and still have people getting groceries and making Target runs and all of that. In September, it was not clear whether this positivity was the result of colleges or students away at college who were getting sick but using their home address as the residence. The state tracks this data by residents. But we kind of hit an equilibrium, and that equilibrium lasted really until the end of October. But since the end of October, we've seen a remarkable change in the trajectory of the positivity rate. And that change in trajectory has been very sudden and pretty rapid. One of the other metrics was new daily cases per 100,000 residents. So again, this metric was very low over the course of the summer. This we do have broken down into the Syosset-Woodbury community versus all of Nassau. And I was proud of the fact that Syosset and Woodbury were below the county average for nearly the entire period of the summertime and then going into the fall. And we've managed to remain below the county average even during this uptick. But what we're seeing now in just this, again, last 2-week period is a pretty sudden shift in the number of new daily cases. And again, we've crossed that threshold that the state uses to start to identify a hotspot and maybe even designate the microcluster strategy. So I should just spend a second and talk a little bit about the state's microcluster strategy. For a region that is designated as a yellow zone, the schools in that yellow zone, if they want to stay open for in-person learning, must test over the course of 2 weeks 20% of the student and staff population in the school. So this has already happened in Nassau County. The Lawrence School District was designated as a hotspot. They ended up closing for 2 weeks. They did do the testing and they were able to reopen in their 3rd week. And they were successful in leaving the yellow zone and driving their numbers back down again. So obviously this would be very disruptive to a community to have to close for 2 weeks. And so, you know, we're certainly attentive to this strategy and trying to make preparations so that we're not scrambling. And no one knows how far away we might be from designation as a yellow zone. But what I do think will happen is if a yellow zone designation is made, the scrambling will be in a number of school districts. And we'd like to try and think ahead as much as we possibly can. So one of those strategies is to partner with our school physician. Now, our school physician already works for Mount Sinai South Nassau. So we already have a relationship. We've worked with Dr. Marino for a number of years, almost since I've come to Syosset. He joined us shortly thereafter. I find him to be incredibly knowledgeable, incredibly accessible, a terrific partner in the work, and really gives us a lot of guidance and very confident decisions that we can then rely on. So the idea came to expand our relationship with Mount Sinai South Nassau to include making a testing site available. And I think it's important to note that this rapid test site is simply a satellite of Mount Sinai South Nassau. It is not the school district getting into the business of being a healthcare entity. What we're providing is a tent under which sample collection will be able to take place and a trailer in which the samples can be run. But this will be Mount Sinai South Nassau. This will be their testing facility. They will supervise the nurse and make sure that the training is done and that there's getting the kits and all of that. And importantly, maintaining all of the data from this. So even, I don't know how the state will implement their microcluster strategy, but what I can say is what we know from the experience in the Lawrence School District was even when the expectation was that there would be testing of 20% of staff and students, it was not made mandatory for any one individual. So that's the one experience that we're able to examine and understand. My understanding and my conversations with Dr. Marino is that all of the rules around health remain in place because, again, this is service provided by the hospital. It's just located here for convenience sake. And also for convenience sake, we're going to limit it to members of the educational community. So this would be students, staff, immediate family members of students who want to rule out the possibility that they might be sick, so a sibling could continue to go to school, for example. And by limiting it, what we've seen recently, especially in the last 2 weeks, is long lines at testing centers, difficulty getting appointments at testing centers. I've even heard of residents being turned away from testing centers. And so by creating and identifying an opportunity to create some capacity of our own, we try to make sure that residents of the school district will still have access to testing, even if the demand continues to increase for the providers that already exist in the community. But there's nothing that says someone has to use this. You still use your pediatrician, the urgent care that you have a relationship with. This is simply another option that is available. The cost is underwritten by insurance, just as it would be. This is a healthcare facility run by the hospital, and the testing is covered just as it would be at any other healthcare provider that offers rapid testing. So Dr. Marino, I know you wanted to talk just a little bit about who should and who should not come to this center.
Yeah, you've clearly pointed out that this is going to be for the Syosset community, the educational community, and it's not becoming an urgent care center or a healthcare facility. So we're not there to take care of or to test people who are experiencing severe symptoms, high fevers, pneumonia, that sort of thing. That goes to the healthcare system. However, if we have people with minor illness, like a kid says, I think I have a sore throat or a runny nose, or if someone just wants to know, my sibling came back from college and I'm just concerned, I'd like to know if my other kid that's in the school system is positive or not, we'll offer that service with an accurate rapid test, not a PCR test at this time. It will be either a Sophia or Bionx test, but we'll have a relatively sensitive and certainly a very specific test that will be offered in the circumstance of people that need it but are not acutely ill.
Dr. Marino, this question of accuracy, and I know accuracy is not exactly the right term to use, but the use of rapid tests and PCR tests, these Sophia and Bionx Now tests that you're planning to use in this location are different from the rapid tests that we're more familiar with. And can you just describe that a little bit for us?
These tests are 97 to 98% specific. Now, that is, if you get a positive test on either of these, and they're very close in terms of their predictive accuracy, you can rest assured you have COVID-19. On the other hand, they are not as sensitive as the PCR test. The PCR test will pick up fragments of genetic material from the virus, and it may actually, you may trade off a little specificity for sensitivity with the PCR, meaning that the PCR may actually be positive in people who are not contagious, but have leftover pieces of viral genetic material. So the rapid test has the advantage of being a quick answer that's available right now within minutes. And if it's positive, you know you're positive. If it's negative, there is a small chance, but it's in the 2 to 3% chance that you could still be a positive. But these are not people who are acutely symptomatic or ill. These are screening people.
So one of the advantages of this partnership is that we'll know which test is being used. And because the Sophia test and this Bionx Now test have 97, 98% specificity, if I'm getting that term right, then we know that this is going to be more accurate than some of the tests that are available at other kinds of rapid testing centers. And so again, that will give us more confidence in the results from this particular test.
Indeed.
So I'm sorry, go ahead, Dr. Marino.
No, I was just going to say, indeed, you've characterized it correctly and appropriately. And right now, the Bionx test is only available to government institutions. Abbott Laboratories does not have an adequate supply to give it to everyone who wants it. And they're anticipating that their supply will be increased over the next month and that it will be going to institutions other than government, such as hospitals, starting in December. So we are awaiting the Bionx to be delivered to our site in December, but we haven't an exact date on that yet.
Right. And it'll be the Sophia test in the meantime, which is about 1% less than the Bionx test.
Exactly.
Great. So we've had a lot of questions about how we do contact tracing, why some people are considered to be contacts, why some people are not considered to be contacts. We have a team here that does this, and that team is led by Ms. Gonzalez, Nurse Gonzalez, and Dr. Curry. They have been spending long hours, and unfortunately, in the last couple of weeks, those hours have become really long as we've been dealing with a little flurry of cases. So I'd like them to just talk you through what the process is and how we go about this, and what their algorithms are. They've taken the Johns Hopkins contact tracing course, the same course that someone who would go to work for a health agency and do contact tracing would take. So we're very familiar with how this all works, and I just want them to kind of walk you through it. So Teresa and Joan, take it away.
Thank you, Dr. Rogers. So when the virus hits home or close to home, it initiates an important conversation, and there will be multiple conversations, but the key factor is that they begin as soon as possible. You'll see on the slide here that we have set up an email address, and it's fairly simple. It's reportcovid@syossetschools.org. And one of the key aspects to the schools and to us supporting the families that unfortunately are impacted is the timing of being notified. So we are asking that if you or your child at any point are either tested positive for COVID, or if you think that there is something that is concerning regarding COVID, please email us. We're monitoring this email site 24 hours, and within the most part, you will be receiving a phone call from one of our team within the hour after posting this information, because that'll be crucial for us to put our program into place. And what we'll be doing is we'll be talking to you. We'll be asking some key questions regarding the confirmed case. And then we start talking about contacts. And in order to be considered a contact, the Department of Health and the CDC have set up some guidelines and some parameters. And one of those parameters is the concept of distance and how the proximity that you or the individual were to one another. And for the cumulative amount of time. So they've now identified that key time frame of being a cumulative amount of 15 minutes within a 24-hour period. The other key aspect is the timing of that interaction. And the key point will be to look for what was happening 48 hours prior to either onset of symptoms or a positive test result if the individual was in fact asymptomatic. So we will be talking a lot about that. So if an individual is deemed to be a contact, and we'll speak a little bit more about all of the aspects of how you are identified as a contact, but if you are identified as a contact, that individual would be required to quarantine. And that quarantine date, or excuse me, quarantine time is 14 days. And it will be 14 days from the interaction or the actual contact. The individual that is a confirmed case would be required to isolate, and their isolation time frame is typically 10 days as long as symptoms do dissipate. A lot of the questions we get after we're speaking to families is, what does this mean for either my child's siblings, the other children in the home, or to adults that may live in the home? Those individuals would be considered contacts of contacts. So if person A is the individual that has been defined as a confirmed case, person B has been in contact with person A, anyone now who is in contact with person B is considered to be a contact of a contact. They are not subject to quarantine, but certainly should monitor any symptoms that may appear, and at which point then seek the advice and counsel of their physician. But at that point, the CDC and the Department of Health, they do not necessarily worry about contacts of contacts. What we do and what we would like for you to know is, again, the key is the timing. When you notify us of this information, we can then mobilize. And one of the aspects of our mobilization is reaching out to our custodial staff. Each and every night, every single one of our buildings is cleaned to a very high level of sanitization and deep cleaning every night. If we are notified that there has been a possible COVID case in any of our buildings, we are then able to further mobilize our custodial staff. And in some cases, they have worked overnight so that we could be prepared to open buildings with clearance from the Department of Health the very next morning. And at that point, they then elevate cleaning to an even higher level in order to ensure the safety and health of all that will be entering the building, in some cases, in just a few hours after that. At this point, Dr. Rogers, we can go on to the next slide, please. This slide is very helpful. It's actually very helpful to read from the right to the left, because this is how the process takes place. So we begin, and an individual has been deemed either positive because of a test that they have taken, and they have symptoms. At that point, the questions will be, what did and when did the symptoms start? If you do have a positive test, where did you have the test taken, at what time, and what type of test was given? We then work backwards. We take a look and start asking questions about what happened in the 48 hours prior to either the onset of symptoms or to receiving a positive test result if in fact the individual was asymptomatic. And that becomes our core group of what we're looking at for our individuals that could potentially be close contacts. And we then have our rule of 3. At all times, our protocol in the buildings requires that individuals are wearing masks, maintaining 6-foot distance, and we do also have our polycarbonate barriers. We're always looking for at least 2 of those 3 aspects to be in place. Obviously, when all 3 are in place, that's optimal. But as long as we're ensuring that there is social distancing, masks are worn, and that barrier is in place, we are able then to work with the Department of Health to really identify who could potentially be contacts and who we can rule out as being contacts. Now, there are 2 other factors that come into consideration that we do not have as much control over. Obviously, the age of these students, we don't have control over that. The Department of Health does have a greater heightened level of concern when the children are younger, when we're dealing with our kindergarten, our first grade, and second grade children. There is a heightened level because for as wonderful as our kids are, and they are wonderful, they are doing their very best to keep all protocol in place, but there could be more of an inclination perhaps for a mask to come down at more points, a little bit closer interaction. And while our teachers and our support staff and our adults are really keeping a very close eye on the children, the Department of Health does sometimes, they are a little bit more suspect of the fact that all the protocol are in place to the fullest extent. And that's why they do dive a little bit deeper into situations that involve younger children to make sure that we're not missing out on identifying anyone that could be at risk. The other instance, or the other factor that we don't have a tremendous amount of control over, is the amount of cumulative time. Because as we are in school together, our interactions are such that that time can add up. So the reason we have our 2 out of 3 rule, or if possible, to have all 3 protocol, mask, distance, and barrier in place, is to also minimize and offset the factors that are less in our control, the amount of time and the age of our students. So what will happen then is the individuals that are deemed to be contacts, we will then be reaching out, and we start our telephone calls, and we're reaching out to individuals, and you will get calls from the core team, and we will begin to have these conversations. And if an individual is deemed to be a contact, we will then discuss the aspect that the individuals will have to go into the 14-day quarantine period, where we can monitor if they're onset of symptoms and get them the help they need, or hopefully it will be riding out of quarantine to make sure that they are not, in fact, incubating the virus. And then at the end of the 14 days, they are healthy and safe to return to school. Some of the questions we get require, well, what happens prior to 48 hours? What happens if I was exposed to someone 4 days prior to their positive test, or 4 or 5 days prior to the onset of symptoms? According to the algorithm, that individual would not necessarily be considered contagious because it's outside of the 48-hour window. However, it is always prudent to certainly monitor for any symptoms, and again, increase the safety protocol, increase hand washing, increase mask wearing. Distancing is very important on the off chance that the individual somehow was exposed. And at this point, I believe, Nurse Gonzalez, would you like to take it over from there?
Sure. Thank you, Teresa. So on this slide, you can see the differences between quarantine versus isolation. A quarantine, as Dr. Curry explained, is when you are deemed a close contact to a known case. Quarantine period is for 14 days. During that 14 days, you should monitor your symptoms, avoid contact with high-risk members of the family, and if at all possible, remain in a separate part of the house. We always suggest that if someone can stay in their own bedroom at that time, and if they have a separate bathroom, that is the ideal situation. Not everyone has that availability. So if you do not, you obviously will use the bathroom that you're sharing with others in the home, but we ask you to be prudent about cleaning the high-touch surfaces, your doorknobs, and anything, the faucets in the bathroom, anything you can. But the person should be quarantined. Therefore, you want to minimize your contact with anyone the best that you can. And I always say quarantine doesn't mean that you just don't attend work or you just don't attend school. That goes for the same in your home. So that quarantine period is very important. There are always questions about, well, what if I test negative during that 14-day period? Do I get to be released from quarantine? And the answer is no. That set period is there for a reason. At any time during those 14 days, you can become positive. And we have seen that in some cases where people have been in quarantine and then we're later notified that they developed symptoms and they do become positive. So it's very important that you follow that 14-day quarantine. Now, the difference between the quarantine and isolation is someone who's in isolation is someone who has actually tested positive. They are sick with COVID and their symptoms can be minimal or it can be a stronger case. But either way, you do have to remain isolated for 10 full days. You must segregate in a separate part of the home with an unshared bathroom if you have that option, and sleeping areas. Obviously, provide food without interacting with others in the home. I always suggest that if someone can offer that person in isolation their meals on plastic utensils and paper plate or something, that would be ideal. Obviously, if you have a small child, you cannot totally isolate them. They still need the care of their parent. So either way, 10 days is a period of isolation. And although somewhere in that 10-day period, maybe even after day 3, you're feeling great and you don't have symptoms anymore. And someone may think, okay, well, it's safe for me to now, get back out into the community. No, it is not. You need to complete that 10-day period of isolation. That's very important. The next slide will show us exactly how we calculate that. The top part is the isolation of a confirmed case. And we look at the first day as the day that they tested positive if they have no symptoms or the onset of symptoms. So if someone tests positive on Tuesday, but they say, on Sunday night, I did have a sore throat or I felt a little achy. Well, then we're going to look at that day, the first day from their first symptoms. And they will have to complete that 10 days, as I said. And at the end, you need to see if you're symptom free, no fever for at least 24 hours, 72 hours symptoms improving. So sometimes this time frame may not be 10 days. If on the 9th day you're still running a fever, well, that period is going to be extended. So that 10-day period is not written in stone. You need to be aware of your symptoms. You need to report those symptoms. And anyone who's positive will be in touch with the Department of Health. They will notify you. There'll be someone checking in with you. The only problem with this right now is, as Dr. Rogers mentioned, there has been a bit of a slowdown due to the rapid number of cases in the county. So the communication with the Department of Health may be a little less frequent than it was before, but they do text you or they'll communicate with you via phone, but they will check in with you. And the same will go for quarantine. So here is the scale for quarantine for 14 days. The typical incubation period is somewhere between the 2nd to 5th day. That's usually when we see someone convert to a positive. As you could see, day 5 is the first valid test day, and days 6 through 14, you still have that potential to become positive. So that's why you must complete the 14-day quarantine. Some people get confused when it comes to quarantine and an early release with traveling. That is not the case when you are a close contact. If you are deemed a close contact, you must complete the 14 days regardless of how many times you've tested negative for COVID. And obviously, if there are no symptoms at the end of the 14-day period, then you're free to return to school. Many parents call and they ask, well, do we need a negative COVID test to return to school because my child has been in quarantine? No, you do not. We do not require a negative COVID test to return to school after the 14-day period has been completed. As long as that person is symptom-free, you could return to work if you're an employee, or you could return to school. Okay. Our next slide. Did you have a question, Dr. Rogers? You're muted.
Sorry, I couldn't get the unmute button to appear. I was just going to thank both of you for the hard work that you do. One of the questions that we get is, how is it possible that the district is able to turn this around so quickly, and even after a case is identified, we're still able to open the next day? And the answer is really twofold. The first is that we work very hard at that. And part of working very hard at that is the three people who are on this call with me, Dr. Marino, Nurse Gonzalez, Dr. Curry, work very late hours to try and make sure that we're ready to open the next day. And it is not uncommon for them to be still at it at 10 o'clock at night, making sure that they've got the last pieces in place. As Dr. Curry said, our custodians have often come in overnight to do whatever is necessary. And we've been able to stay in contact with, and right up till 10 o'clock at night, the health department, which has been just an incredible partner in all of this, really accessible, really thoughtful, very helpful to us, and willing to help us make decisions, and make decisions on their own that we can then follow. Again, I do see us moving into a different phase with the health department because of the impact that they have. We'll continue to rely on Dr. Marino as we have in the past, but that one other partner may not be quite as accessible as it has been, but Dr. Marino remains very accessible to us. But really, the secret sauce is how late into the evening this team works to make sure that they get it right. As I mentioned earlier, the state put together a dashboard, and it's online. Early on, there were some inaccuracies in that dashboard, and we thought it would be helpful if we had a dashboard that we could control, so that we could put data up ourselves, and we would be able to correct it if there were ever any mistakes or something like that. And we came up with the notion of identifying cases that were more than 14 days old, and illustrating those differently from cases that are less than 14 days old, because we wanted to know if we had any cases, as I said earlier, that had any follow-on transmission of the virus. And so far, for all of our resolved cases, we have not seen any further transmission of the virus in the school environment. That doesn't mean that somebody who was a close contact because of a community contact didn't eventually become positive themselves. But in terms of the school environment, that has not happened. Guidelines for out-of-state travel. The governor, about a week and a half ago, changed the guidelines for out-of-state travel. They have been worried about higher rates of transmission in other states, and having travelers bring COVID potentially back to New York, or increase the rates of transmission here. The change in algorithm has been that the governor now will let people test out of a 14-day quarantine, but only if they test before they leave the other state, and they test after they return to this state. And for the same reason that Nurse Gonzalez illustrated, it can't be just right away. It has to be after several days, 4 to be exact. You can test here in New York. And if you have 2 negative tests, then you'd be released from quarantine. So the governor has also put an executive order that has some pretty strict penalties for not complying with his travel orders. And again, all of this is about risk. And the part I want to return to is, we've seen obviously a baseline level of risk. Those were the numbers that we saw over the summer, but it does appear that more risk is being taken. And as a result of that, we're seeing the cumulative effects of more and more risks. No one risk is a game changer, but cumulatively, all of those risks that are being taken are changing the nature of what's going on in our county, in our community, in our state. And we have the power within us to turn that around, but we have to choose to do it, and we have to kind of all choose to hold hands and do it together, figuratively, obviously. No one's allowed to hold hands. We do have to find a way to do it. And the good news is, in other parts of the state where there have been yellow zones and orange zones, those communities have been able to get their positivity rates, their transmission rates, their case counts back under control. And the governor has released a number of communities from the yellow zone status, including Lawrence here in Nassau County. But it's important that we realize that the more we minimize risk, the fewer risky things that we do, the less we congregate, the easier it's going to be to bend that curve. So with the time that we have remaining, we're going to take a number of the questions that we've been getting from members of the community over the past couple of weeks. We're going to spread them around the group here. Some of them will be for Dr. Marino, some of them will be for the contact tracing team. And then we do have a little treat for you at the end of our program tonight. So with that said, Dr. Marino, first and foremost, what should somebody do if they are experiencing symptoms? Let's get that out of the way first, and you'll need to unmute yourself.
If you have symptoms, and it's important to recognize that COVID has protean symptoms. That means that it can be GI symptoms like stomach upset, vomiting, diarrhea, nausea. It can be just lethargy. You know, respiratory, everyone knows, but you know, if you're congested, sore throat, coughing. So there's a lot of symptoms, headaches. So if you have any of the symptoms that are compatible with COVID, you need to see a physician and get tested as quickly as possible. It is important for the physicians in the community to understand that if you go to them with symptoms like of congestion, they need to do a COVID test before you can return to school. They can't just say, this looks like a virus to me. So you always need to get COVID tested when you have symptoms. The only exemption for that is if there is a laboratory confirmed other diagnosis. In other words, if you go to a physician because you have body aches, fever, congestion, and you have a rapid flu test done and you have the flu, or you have a rapid strep test done and you have strep, then you don't have to be COVID tested. You still could be, but you don't have to be COVID tested in that circumstance. But the take-home message is, if you have symptoms, get tested as soon as possible and stay away from family members. Don't socialize, don't go out in the community, isolate yourself until you know what's going on.
Great. So if a college student is returning home to the family for Thanksgiving from another state, does the whole family need to quarantine?
No, the student from the college should quarantine themselves, but the rest of the family does not need to quarantine themselves. And as Nurse Gonzalez pointed out earlier, you know, within the family, within the household, hopefully you can do a reasonable job of isolating yourself or quarantining yourself away from the rest of the family. But the rest of the family does not need to quarantine.
All right, one question, and I think Nurse Gonzalez addressed this. If my child's in quarantine, is there a way that I can get a negative test that allows me to come back out of quarantine?
And the answer to that is no. Oh, was that question for me again?
It can be for you or for Dr. Marino.
Yeah.
One question that I've gotten has also been about rapid tests versus PCR. We've talked a little bit about their relative strengths and weaknesses. One thing that it's important to know is that those tests, there is something that the state has given us an awful lot of guidance for how to do things these days. And they have a return to school protocol, as Dr. Marino mentioned. If you exhibit symptoms that could be consistent with COVID, in order to come back to school, you have to be able to either rule out COVID with a test or have a laboratory confirmed explanation of an alternative diagnosis. In that return to school protocol, the state does allow both rapid tests and PCR tests as return to school COVID tests. So the one advantage we have in this partnership with South Nassau is we know the level of accuracy of the test that's going to be used in that partnership, and they're tests that will give us more confidence in the result.
Tom, can I say something about?
Please.
There's one other thing that will exempt you from getting a COVID test with symptoms, and that is if you have an ongoing known chronic illness and the symptom is compatible with your chronic illness. So for example, if a child is in the school and is known to have migraine headaches and has a note from a doctor that this child has migraine headaches and will periodically have headaches and nausea from that condition, and then they go to the nurse with headaches and nausea, they don't have to have COVID testing, because the symptom is compatible with their chronic illness. They could have COVID testing, but they don't absolutely have to have it. So it would be helpful for anyone who has children with chronic conditions like allergic rhinitis, like asthma, like migraines, to have that on file with the doctor's note saying this child has a chronic condition and these are the symptoms that may occur as a result of the chronic condition.
So, Dr. Marino, if there were more than one positive case in a school, can you just talk a little bit about how we would consider, how we would investigate that and decide whether the school needed to close or not?
Well, in part, it would be important to look at where the cases occurred in the school. Is the case in one classroom? Is it in multiple classrooms, multiple parts of the school? If there are more than one case occurring throughout the school, we have a much bigger problem than cases occurring within the same classroom. So that's really an important piece of that puzzle.
Nurse Gonzalez, we sometimes get asked if a child is in quarantine, if they can have play dates as long as that's with other quarantined children. What's the advice that you're giving?
No, I think that's not advisable. As I said before, if you're in quarantine, the purpose is to, I like to say, lay low. You don't want to socialize. The idea is the possibility that you will become positive. So therefore, there should be no play dates, no extracurricular activities.
So, Dr. Marino, can you just talk about if a child is on a team with another child who tests positive, but they haven't heard from us, should they be concerned or should they wait to hear from the health department?
If the child on the other team tested positive, the important question is, what was their contact with the other team member? So if we're not having contact sports at this time, but the kids get close together on benches and they congregate. So if the kids are considered a close contact, which is, 15 minutes in a less than 24-hour period, the health department will contact you if you're a known contact. So yes, you should be concerned, but you should await the health department contacting you.
We do get asked from time to time whether we can talk about what class the student who tested positive is in, even if we don't disclose the name. And the answer is we can't. We have some very strict privacy rules, and those rules require us to make sure that it wouldn't be possible to work backwards by, say, observing who is absent the next day to try and identify who is the case. So we have to be very specific so that it is impossible for someone to be able to determine. But we do make sure if there is any possibility that there are two cases that might be related, that we run that down and we're absolutely satisfied that there isn't any relationship between them. Dr. Curry, protocols for lunch monitors, can you just talk about that a little bit for us, please?
Sure, absolutely. So our lunch monitors have also been informed regarding the safety and health protocols they need to be following. And we've actually instituted even more so because they are, in fact, in many cases, handing children their lunch, their packaged lunches. So our monitors at all times are wearing their masks. They do their best to maintain as much social distance as possible. And when they cannot, as a result of handing out a lunch, it is a momentary interaction where the distance is breached, but then they step back out again. There is sanitization of hands. There is glove wearing as far as interacting with students as well. And again, one of the things that the monitors actually came up with, which is working very well, is in order to encourage the children who in many cases have been sitting in their desks, at their desks for most of the day with their polycarbonate barriers around them. They do want them to enjoy their lunch, and it is an important time for children. And at that point, obviously, if they're eating, their masks are down. So in order to make sure that we're keeping as much safety protocol in place, the monitors often situate themselves in the front of the classroom, where they are in what we call the teaching zone, which is a safe distance away from even the first row of desks. And they engage in either conversation, discussion. In some cases, there's There's songs and so on that are being sung in the classrooms of the younger children to keep the kids facing forward, because the tendency might be otherwise to turn around and to talk to one's neighbor. But because it's important to keep those polycarbonate barriers between children, as far as when they're eating their lunch, the monitors do engage in that as well. And then as far as cleanup goes, when the children are done and the masks are back on, the monitors assist with the cleanup of the materials, as well as the need to wipe down the desks and make sure everything is nice and clean to go back either to recess or to go back into the instructional mode for the classroom.
So, Dr. Marino, we have always asked when there is a close contact, even if there's an asymptomatic sibling, we ask for the sibling to get tested as well. And there has been some of the pediatricians in the community have not been as willing to pursue that as we would like. And I was just wondering if you could just explain why that's something that we feel is important.
Well, this is a learning curve for everyone. This is a whole new world, and it's a whole new world for doctors as well. We're used to being, somewhat in charge, and, doctor knows best. And now we're being told by the health department of ways that we should practice. And it is important, if a sibling is a contact of a known case, that we get the information as to whether they are turning positive or not, because that will impact on how we relate to all the rest of the class and the other people in the school and their close contacts. This is epidemiology at work, and not every physician in practice has been thinking in a public health model, in a disease prevention model, because physicians work one-on-one with patients, and now we have to step back and think about the whole community of patients. But it is important, if you've been in contact with someone who's positive, to get tested. And hopefully the physicians in Nassau County mostly are getting on board. It's, we have meetings too. We have Pediatric Society meetings and hospital meetings, and those have all gone virtual. And so I don't know if physician learning curves have slowed down a little bit at times too, because we don't have as much access to one another for conversation.
Thanks for that. A handful of questions in here about closure, and I'll sort of sweep them all up into one and say that there are questions about who makes decisions around school closure, and the answer to that is, if they're short-term decisions, the district makes them. If they are longer-term decisions, that would be made by some other authority, likely the governor or Albany generally. Questions about how we make that decision. We make that decision in conjunction with the health department, and obviously, Dr. Marino, your support and assistance as well. And we're all obviously aware of the fact that New York City announced that it's closing in-person instruction starting tomorrow, and questions around what the triggers might be for us. I went through a lot of that with the microcluster strategy earlier in the presentation. Again, we don't have all the data points that the state is using. We don't have access to all that data. So we are watching closely the data that is available and seeing that obviously the numbers are rising. And so if the numbers continue to rise, it really is only a matter of time. So we've gotten a number of questions about what our intention is for the school's calendar, the school schedule. We have been trying, and we have made a significant investment in trying to reopen in-person learning and preserve in-person learning as much as possible. I think our virtual teachers have been doing an amazing job. I was in a virtual classroom today and just astonished at how great the lesson went. But we also know that we do our very best work in person. We know that students thrive on the socialization of being in school, even if it feels like an abnormal school environment with all this distancing and plexiglass, et cetera. It's still an environment where kids are able to socialize. They're with one another. The learning is more facile, and we're trying to preserve that as much as we can. We can't do that alone. We absolutely have to have the cooperation of the community that we love working for. And for us to preserve that in-person learning, we need your help, we need your assistance. Our intention is to be open every day that we possibly can. We're not preemptively planning on any days to close. Now, circumstances may change that, and as I said earlier, it seems like every week is its own brand new learning curve. And we start from scratch on Monday and we just start figuring it out all over again. But it's not our intention to close if there isn't a good reason for us to be closed. And what we need is for the community to be partners in that with us. It's really the only way we can. So I want to finish by just saying, first of all, thank you to Dr. Marino, thank you to Nurse Gonzalez, Dr. Curry for making the time available. Thank you to Tricia Williams for putting the presentation together. We keep a running document with a lot of Q&A in it. Some of that was addressed tonight. That document will be shared online as we've done with previous Q&A documents. You can continue to send questions in. We'll have an email address on the document where you can continue to send questions. We'll incorporate them into future drafts of the Q&A and keep it online. And again, the most important takeaway from tonight's conversation is that we've entered a different phase. That phase is clearly having an impact. We can only look to our west and see the impact that this new phase has had on New York City and not want that for ourselves. And I do believe that our fate is in our own hands. I do believe that we can control this. I think the example of other regions in the state that were yellow and orange and have turned it around and are not designated anymore shows it can be done. This is not out of reach. This is certainly not beyond the ability of a place like Syosset to pull off. So we just all have to pull together if we want to pull it off. So the last thing we're going to do tonight is talk a little bit about COVID fatigue, because we're going to have to get over our COVID fatigue if we're going to be able to really flatten this curve. And I know I'm tired of things, but early on in this process, I would say that we're 4 months into an 18-month crisis. We're 5 months into an 18-month crisis, 6 months into an 18-month crisis. We're now 9 months in, and we're starting to see glimmers of hope on the horizon. Vaccines that are having very promising results. And we're all hoping that they continue and that ultimately this really does turn out to be merely an 18-month crisis, not merely, but we're hoping that it only lasts 18 months. And if that's the case, then we're at the halfway point and we can't give up now. The things that have been working, our masks, our social distancing, our caution, all of these things are getting it done, even if they're uncomfortable, even if they're inconvenient. And this is only for now. We will get through this. We will get past this. And I want you to stay safe, stay strong, stay healthy. Have a great night.